It's Dr. Marty Makary must be pulling his hair out with this. He's a surgeon, a professor of health policy at Johns Hopkins. He's the author of the book, The Price We Pay, What Broke American Healthcare. Dr. Makary, it's been a very aggravating week coming from this White House as it relates to our health. They're deciding that everyone better get the shot, or you got to either, now they're going into our business, our occupation, and I think you know this. A lot of nurses are deciding to quit. A lot of healthcare workers deciding to quit. A lot of people are saying, I'm not going to be forced to be vaccinated. I quit my job because of this upcoming mandate that the president decreed. Is this going to help?
Well, I've been following the numbers, Brian, and one of the goals of the vaccine mandate by the White House, recognizing it may not withstand legal challenges, was that the buzz that you may need a vaccine in order to keep your job was going to get people to get out there and get the jab. Looking at the numbers, in the days since the announcement, which was 5 days ago, vaccinations are way down. They're not even level from where they were. They're down. So it really has polarized people. And I think people with positions against just the government, separate from the vaccine's effectiveness, are more entrenched right now. So it's backfiring.
You think we should get vaccinated, right?
Absolutely. For non-immune adults, if you haven't had natural immunity, those are the folks right now dying at a very high rate, 1,000 people a day. And that's where we got to put all of our efforts. Everything else is a gigantic distraction. You know, the unvaccinated somehow are posing a public health threat to the vaccinated, or a cloth mask on a 3-year-old child. These are distractions from our main focus.
So now we have the question of, before I leave the mandate question, I would just want you to hear Joe Biden the other night, cut 29.
I'm announcing that the Department of Labor is developing an emergency rule to require all employers with 100 or more employees that together employ over 80 million workers to ensure their workforces are fully vaccinated or show a negative test at least once a week. We're going to protect vaccinated workers from unvaccinated coworkers. We've been patient, but our patience is wearing thin.
Okay, this was him earlier, along with Psaki, Pelosi, Fauci, cut 30.
I don't think it should be mandatory. I wouldn't demand to be mandatory, but I would do everything in my power. Just like I don't think masks have to be made mandatory nationwide.
Can we mandate vaccines across the country? No, that's not a role that the federal government, I think, even has the power to make.
We cannot require someone to be vaccinated. That's just not what we can do. It is a matter of privacy to know who is or who isn't.
No, definitely not. You don't want to mandate and try and force anyone to take a vaccine.
So we're at 75% of the country eligible has gotten at least one shot. And they're saying desperate times, desperate measures. They've totally flipped. What happened?
First of all, Brian, that's an amazing clip of a litany of all of these figures talking about how we would just never do this mandate. And here we do it basically on the 1 yard line, because we're never going to get to 100%. Even the required vaccines in children reach a 90% compliance rate. Otherwise, people just don't do it, or they have medical exemptions. So if we're at 76% now, and our goal is to be in the 80s, and roughly half of the unvaccinated have natural immunity, they're using a very heavy hammer for a couple percentage points. And Joe Biden said in his speech announcing the mandate that the unvaccinated were preventing us from turning the corner. Well, how's he going to feel about the mandate in a month and a half or 2 months when we're at very low levels of COVID, which is what Delta is showing in India? It's kind of a boom and bust. So when we're at very low levels and this mandate finally gets through its writing process and the legal challenges, and then add a few weeks for people to come and get it, and then the immune system to kick in, doesn't happen instantly, we're going to be at very low levels. How's he going to feel about the mandate then?